Hello everyone, this is your host Teha Roham, and today I'm here with Pune's famous urologist, Dr. Vilas P. Hello sir.
Hello, madam.
Who is also a head of Department of Urology in D.Y. Patil Medical College and Hospital, Pune. He's also having a well-equipped setup for urology in Pimpri Chinchwad. Hello sir, how are you?
Fine, madam. Thank you.
So, as our audience knows that we are here to discuss overactive bladder. So, I just want to know what is overactive bladder, sir?
It is called as OAB or overactive bladder. Overactive bladder, normally the bladder of urinary bladder of any human being is expected to store urine for certain period of time silently, and it should void when the person commands. It should not start voiding at its own way, which is an involuntary leak. So overactive bladder is a group of symptoms typically coming with increased frequency of urination, where the person keeps on going too oftenly, too frequently than acceptable. Then it is associated with urgency, where the person has an urgent desire to void, where he cannot control. He has to run, leave aside the job, whatever he's doing, and run to the toilet. Then it is associated occasionally with urge incontinence or urgency incontinence. Means by the time the person reaches to the toilet, he or she starts leaking few drops of urine in the undergarments. And this symptom complex is also associated with something called as nocturia, that is going for urination too frequently during night time, during the sleep time. Normally one is expected to go for maximum 1 or 2 times during sleep. Anything more than this is problematic.
Alright. So, I just want to know how common is this condition?
Basically, this condition is definitely very significantly prevalent in the society. But it is more common in old age, especially female or even old age males. And most of them take this as a part of the aging process. And they feel pretty awkward to come ahead with these symptoms openly. And that's why this condition is reasonably underreported. Otherwise, it is very common condition, and uh, it should be reported more frequently because it is going to affect the quality of life, and it has a treatment also.
Okay, and what are the causes of this condition?
Typically overactive bladder is without any direct underlying causes, but it can be due to neurological causes. Then diabetes mellitus associated with neuropathy and what we call diabetic cystopathy, where the bladder is affected because of diabetes. Then it can be due to urinary infections. Then it can be due to other stones or other infections in the bladder.
Right, and what are the symptoms of overactive bladder?
As I enumerated, it is associated with increased frequency. Person keeps on going too frequently. Then it is urgency associated with occasional urge incontinence and nocturia.
Alright. So, yes, now moving on, let's just ask third question. So, can OAB affect the QOL?
Definitely. QOL is quality of life. For any person of any age, if he has to depend on toilets or availability of toilets in the vicinity, he can't plan his normal day-to-day activities. Neither he can join with social activities or family gatherings, anything. And this is more common, especially in old age. And unfortunately, in our social scenarios, the toilets for women are very scantily available. So what these people do is first locate toilets in that areas. So the old age male or female avoid going in a social gathering, avoid joining people, avoid family functions, or avoid going for movies or dramas or something where they do not have these facilities easily available. Another aspect is if they have to get up too oftenly in the night time, they do not get a continuous sleep. And obviously that is going to disturb the whole day and the complete health of that particular human being. So adequate rest, adequate sleep is equally essential for someone of old age people, both male and female. And another accidents, freak accidents, if they have to run to the toilet, they easily sleep in the bathrooms and fracture their bones. And that further complicates the whole story. So the OAB problem is definitely affecting the quality of life very significantly.
Got it. So, is it a specific age group that is going to affect?
No, actually, any age group can get affected depending on underlying causes. But yes, with increasing age, both in male and female, it is a very common problem.
Okay, okay. And इसके treatments कुछ available है market में? Do we have to really operate it or medicine से भी heal हो जा सकता
Madam, basically, uh, the patient will awkward to come ahead with these complaints because probably they feel that they might have to undergo some surgery or otherwise they just take it as an aging phenomenon, part of the aging. But these are two extreme ends. Majority of the persons can be treated effectively, safely without operations. There are behavioral therapies available. There are exercises available. Some lifestyle modifications, some drugs, and very, very uncommonly, they will need some surgical intervention.
Okay. And what option do we have in treatments?
These are the options. In a behavioral therapy, normally we have to teach them about the voiding, bladder controls, fluid management. Means they should restrict their fluid from the evening at the night times. Daytime they can take adequate fluid. So restricted fluid intake, bladder training, the pelvic muscle training in female. In women, those who have multiple deliveries, they have laxity of their muscles, which normally support the pelvic floor and are responsible for urinary continence.
So, अगर अपनी लाइफस्टाइल में अगर ये पेशेंट कुछ चेंजेस करे तो क्या ये अवॉइड किया जा सकता है?
Definitely. Firstly, as I told, the water management or fluid management. Second, those who are habituated to tea or coffee, they should reduce this. Those who are taking alcohol too frequently, they should avoid alcohol. So these are the measures which can easily reduce these symptoms significantly.
Okay, on that. Sir, what is bladder diary?
Bladder diary is both. It helps us to know the extent of the problem as well as to monitor the response to our treatment. So, what is bladder diary? Is the person should record the episode of drinking water, the quantity, the episode of voiding, the approximate voided urine volume, and was it associated with urgency and any leakage. So suppose a person is going 15 times in a day or 5 times during night after deep sleep, which disturbs his sleep and he has to go, then this is 20 times. What we normally accept is about 8 to 10 times maximum in a 24-hour period, which just constitute 1 to 2 times at the bed. So night time more than 2 is definitely disturbing to anyone.
So, as you mentioned earlier, that there are some pelvic floor exercises for only females, right?
Yeah.
Is it? So, what are these exercises, and is it really important?
They are very much helpful. Pelvic floor exercises are the exercises to strengthen the muscles in a pelvic diaphragm. We teach these females to do these exercises on a regular basis. In addition, these behavioral changes, in addition, modifications in the lifestyle, fluid restriction. So all of them can be helpful to alleviate the symptoms to a great extent. And beyond that, we have certain drugs which are we commonly using to control the symptoms significantly.
Okay. So if someone has started taking treatment towards this condition, what do you think? How much time it should take to get recovered from this condition, or is it going to be for like 2-3 months? Is it going to be a slow process?
Majority of the patient, if they are compliant, if they are doing exercises, if they are changing their day-to-day activities, reducing their water intake, reducing or stopping alcohol, coffee, other medications. So if there is adequate behavioral modifications, lifestyle modifications, and if they are compliant or treatment, within a 1 or 2 weeks time, they start responding to the symptoms very significantly.
Okay. Okay. So is there any chance that male number is higher than the female, or is it equal?
Uh, Theoretically, they are equal, but the women, the other gender, uh, suffers more because of the social stigma associated. The males can easily have availability of toilets, and so it will not disturb them too much as against to the women. For women, it is quite problematic. Beyond this, there are drugs which I would like to mention. There are something called as anti-muscarinic, anticholinergic drugs. There's a variety of drugs. And even with single tablet in a 24 hours, many of these symptoms can be controlled very significantly. So, and normally a person feels he is soiling his undergarments, he is not controlling his urine, what we call incontinence of urine. It's pretty disturbing for them.
Yeah.
But there are adequate things available which will easily control these problems.
Okay. Okay. All right, doctor.
Thank
so
you.
much,
Thank you.
and
Thank you. It was nice to talk to you.
yes, likewise. Thank you so much.